All right. Hey, we're going to have a little fun today and try to apply some of our lessons learned from the PEDV situation that's continuing, and just kind of give you a feel for what Pork Checkoff is doing along with the National Pork Producers Council and American Association of Swine Vets to try to coordinate preparedness effort for the next emerging disease or even the next foreign animal disease. The problem with the PED situation was it fell in a gray area. It was not a regulatory disease here in the United States, nor was it listed as one of those international diseases of significance that would disrupt trade and commerce. So there was really no regulatory authority for who was going to be lead on trying to handle PED. If we had had foot and mouth disease or classical swine fever or African swine fever, there are established plans where the state and federal animal health authorities take lead and drive the response, and industry plays a support role. Well, when you have an emerging disease with no regulatory authority, you end up having to work cooperatively between the state, federal government, and industry to drive forward a response to it. Emerging diseases were not off the radar. Back in 1998, there was a report issued by USDA. It's called the Swine Futures Project, and it, in one of the chapters, outlined the threat that new emerging diseases pose to the industry, and then put together kind of a cookbook approach on how you would develop a response plan to that in order to address these diseases. The problem is that when you're writing a response plan, in 2001 we had FMD in England, and that became the big issue where, oh man, we need to write a response plan for these foreign animal diseases, and the emerging animal disease planning kind of fell to the back. And that was one of our struggles, is that we identified it a long time ago as an issue, but there wasn't really a driver to move us forward to try to address it. And PED became that driver. If you add together a lot of the diseases that have emerged in our industry over the years, we have porcine reproductive and respiratory syndrome, PCVAD, the novel H1N1, PEDV, swine delta coronavirus, and if you add all of those diseases together and the economic damage that they do to the industry from a production standpoint, we've lost a significant amount of money as an industry since the introduction of PRRS to these emerging diseases. But again, it was PED that really drove the efforts to try to develop a cohesive, cooperative plan to deal with these diseases. Some of our real challenges that we learned from PED is that the pathways for introduction, we might have been a little overconfident. For diseases like foot and mouth, classical swine fever, African swine fever, loads of research, loads of risk analysis, loads of international and federal rules to prevent those diseases from coming into the United States. The challenge is that we have a disease like PED that seems to have made its way either through these pathways or around these pathways. And so we've been working, and so has USDA, on developing a pathways analysis to kind of figure out, all right, how exactly did it get here? But maybe we were a little overconfident that what we thought we were doing to protect U.S. agriculture was going to work for all diseases, and it seems that PEDs exploited a gap. The other thing is that we didn't have a plan, and with PED we had to build everything from the ground up. Really no tools to deal with the disease whatsoever. No reliable diagnostics. No ability we didn't have a vaccine. Any of the diagnostics and vaccines that did exist out in other parts of the world weren't going to cut the mustard here in the United States. And so without tools and plans to deal with it, you have to build all of that from the ground up. That takes time. The other issue is, if it's a non-regulatory disease, who's in charge? Well, I don't like to say who's in charge. I want to know who's in charge of what. It takes a true industry, federal, state collaboration in order to deal with these types of diseases. And we really need to have that predefined. And I'll talk about how we do that. The key to any response to a disease, I don't care if it's a foreign animal disease or emerging disease, is you have to compress the time to determine the scope of your outbreak. And there's certain things that have to happen industry-wide for us to be able to provide that information in a time period that's short enough for analysis to actually determine the scope. Scope determines how you should respond to an outbreak. In order to respond, though, you need to have plans in place, and you also need to have the tools. So, with the cooperative approach for industry planning for emerging diseases, we're working with the American Association of Swine Veterinarians, National Pork Producers Council, and Pork Checkoff. Early on in the PED outbreak, we kind of started breaking it out into areas of expertise and easy to manage this type of preparedness approach. And AASV is working on a swine pathogen matrix. I'll talk about that in a second. Pork Producers Council was working on the response plan, and the Pork Checkoff was working on the swine disease information, or working on how to share swine disease information. When I do my planning, I kind of utilize a process, and there's Colonel Boyd is a military strategist, and he's got a very simple process for that can be applied to planning situations. It's called the OOVA loop. And basically, it's real simple, and everybody in here would agree how simple it is. You observe what's going on, you orient yourself with the information that you've got, you decide what you want to do, and then you carry it out. It all feeds back into the observation, and it's just a big loop. And I've applied this to a lot of the planning side of things, and so I'll try to break out what we've been doing to fit into these categories. Observation. You know, we saw a PED coming, but we didn't really have an opportunity to do anything with that information. 2 years ago, 2 years before PED hit, we were hearing things from folks that had visited over to China that said, hey man, if this disease ever got to the United States, it would just wreak havoc. The problem was there was nowhere to go with that information. And when you are hearing about these new diseases that you don't have here in the United States, you don't really have a good feel for what tools are out there or how other countries are dealing with it. So there's that gap of information. In order to address this particular area, the Swine Pathogen Matrix Project was started. ASV took the lead on that and basically categorized 44 different production diseases from around the world, put them into a spreadsheet, and then started looking at what diagnostics do exist here in the United States or internationally, what type of treatment options are there, what type of prevention tools are out there, what would be the consequences of these diseases. And so through that matrix, they've been able to actually start going down the list of these production diseases. And granted, this doesn't include the traditional foreign animal. We wanted to look really heavy at what we're calling emerging swine production diseases. But what ended up happening is you started to be able to stratify that out as to, there's some new things that might be coming down the pipe we have to be concerned about. For instance, there is a very, very hot strain of pseudorabies floating around in China right now that we don't have much information on. And so we have been working with USDA to try to get the information regarding this particular strain and what particular tests may or may not work for it. Do vaccines that we have here work for it? Will we be able to detect it if it got here? So you can see that as you start putting these diseases into a matrix, it provides you an opportunity to look where your gaps are. Basically, what you want to do with a matrix type situation is target your approach. So what they're going to do is, or what they've been doing is, let's look at the diseases that are out there. Let's prioritize and evaluate what resources and knowledge gaps there are. And then let's figure out a way to cooperatively address those gaps. And then what you do is you establish a mechanism within the United States to try to detect those diseases if they do get here. On the analysis side of things, you want to make sure that you have all the brainiacs in the room to analyze these types of, or this type of information. And so one of the areas that the Pork Board's been focusing on as part of our three-legged stool is the Swine Health Information Center. The goal of this center, or the mission, is to protect and enhance the health of the U.S. swine herd through a couple different mechanisms, targeting the research for these emerging swine production diseases so we have the tools prior to them ever getting here, monitoring on a global level for any new emerging diseases, and then collecting and analyzing swine health data from the industry. This particular center, which was just approved by our board of directors, has been funded. This center is got a 5-year lifespan unless the actual board of directors for this center, along with the board of directors of Pork Boards, agrees to extend it. The goal of this center is to provide a place where we can do the analysis of industry information to industry benefit in a manner where it's held confidential and is not foiable by any government agency or any outside group. This is the way that it's going to be set up, is that we'll have a board of directors, or this organization will have a board of directors, an executive director, and a set of task force to kind of carry out the goals of the mission of the center. That would be research. There would be a research task force, swine disease task force, and an international swine disease task force that would be trying to address those particular areas I talked about prior. If you look at the scope of work, and it's a little hard to see from the back of the room, but you'd have the Matrix project that ASV's been working on. That would be part of the scope of work of this organization. The swine health data management You may or may not know that there's a lot of independent data and information that's out there in different projects. University of Minnesota has a swine health monitoring project. There's the PADRAP, which is the production animal disease risk assessment that AASV has. But we've got a lot of industry information that could be used and analyzed to benefit the industry with emerging diseases. This particular center provides a place for that information to be stored where it's safe and it can be analyzed by specific permissions and by specific groups and to the benefit of the industry without any risk of it being ever put out into the public. What the center isn't, it's not a center that works on disease response planning. It's not involved for the foreign animal disease side or the regulatory disease side. It has only to do with the emerging diseases. It's not going to duplicate what USDA or AASV or Pork Board or National Pork Producers Council, what they do as a normal living. But what it is a way to improve industry preparedness or implement industry preparedness. It's also going to help us improve swine health management and improve the non-regulatory disease response. And it's a tool to enhance the AASV, MPPC, and Pork Board to help us do our jobs better. When it comes to the decision time, that was one of the big gaps that we had, is that if there's no plan out there and no group that's really in charge, you need to basically come to an agreement on a mechanism to put folks in a room to help make the best decisions based on the information that you have. The concept here is the U.S. Swine Health Board. For those in the pseudorabies days, you might remember that there was a pseudorabies control board, so we're basing it industry is basing it kind of on this concept where it is a state federal industry cooperative project. The roles of this board would suggest actions to respond to any new emerging diseases in other countries, as well as actions to respond to a actual incursion of a new emerging disease into the United States. And so basically this board would come into play after, let's say, for instance, if there's an incident in Iowa that's being investigated by the state vet's office, if they're doing a foreign animal disease investigation and it's not one of our traditional foreign animal diseases, this center could come into play to try to figure out indeed what it is and what maybe would be the best course to deal with it. The way that the membership structure is looking, it would involve pork producer leaders from all the major organizations of Pork Board, MPPC, American Swine Veterinarians, ad hoc people as needed. So if that's subject matter experts that you need, you pull them in. Members of USDA's veterinary services, the state animal health official in the state where the disease was occurring, and then subject matter experts as needed. We think that this particular structure would provide an opportunity for people to come to at least some consensus on the best possible approach. But one of the things that you can do with a group like this is if you have a plan that they can look at that helps try to outline what types of approaches you can take when you find these diseases, that might actually facilitate this group to help. And so I'll talk a little bit about the Emerging Diseases Response Plan. When it comes to the action point of it, I mean, that's exactly what you got to make a decision, you have to act. But the goal of it is then you have to take the information that you learn and feed it back into the process so you can adjust it. That's that loop I was talking about earlier. There's lots of actions that you could do if there's a disease outside of the United States. The Swine Matrix Project is kind of doing that. Let's see what's out there. Let's see what the gaps are. Let's see if we can address those gaps so we're not caught flat-footed again. Could be you send experts over there to work with that country. I mean, there's all sorts of things you can do outside of the United States before the disease gets here to try to develop the ability to mitigate that disease. When it gets in the United States, that's where we have to come to determining the scope as quickly as possible, and this is where the traceability fits in. There's a lot of industry data out there. A lot of producers have their own data. They're either managing it themselves or it's in a third-party database somewhere. And every producer in this room wants the majority of that information to stay confidential. When you look at the information that we're used to sharing for traceability, when it comes to that, you're used to sharing whatever needs to go on the health paper to get them across state lines, or whatever you would need for a regulatory purpose to move a pig. What we really need to be able to share in real time is the full traceability of that animal, pre-harvest traceability animal to the packing plant. That means from the breeding herd to the wean to finish to the packer. All of this can easily be done, and everybody's doing it today internally within their own records. But the key here is you have to try to attach that data to one common denominator, and that common denominator is the National Premises Identification Number, which is a 7-character alphanumeric unique number that's issued by the State Animal Health Authority's office when a producer registers to get the national number. And so what we've been focusing on and what we needed with PED and we didn't have was the ability to use that pen to attach bits of data that we would need for analysis for that disease. We have the ability to put validated pins on just about any piece of paper that a producer uses in their production system. You can go to pork.org, enter your Prem ID in there. It'll render out a barcode that you can use. And so we're using those right now, especially with PED, on the diagnostic laboratory submission forms. That was one of the biggest gaps with PED, is that even if the industry, the day that we heard we had it, wanted to share all the information in the world about PED and how to stop it and where it is and where it isn't, people were not using the Prem ID on the diagnostic laboratory submission form, so you couldn't even associate the total positive number of sites that were in the United States. You had to go by the accessions, which is a little bit different than knowing a dot on the map versus when somebody submits a sample. The official Prem ID number tags for sows and boars, you may know about the 2015 Packer requirement for that. That's in play right now. We're seeing about 85 to 95% compliance. The premises identification number on that tag is validated as well. So when we do our sampling for pseudorabies and brucellosis, and when we start bringing on foreign animal disease sampling as part of a national strategy for surveillance, we already have a pin that's deliverable to the plant that can be associated with the sample. The goal here is to make it to where we're using this Prem ID as a normal course of business for our movement records, which need to be tied in to investigations for epidemiology purposes when investigating diseases, but more importantly, attaching it to any diagnostic sample, regardless of the location it's collected and where it goes. We have streams. We have the sow harvest stream, we have the market hog harvest stream, and we have the diagnostic laboratory streams. We need to be able, as an industry, to put those Prem IDs on those forms in order to make sure that it's associated with the results when they're reported out. That's going to go a long way to helping us on understanding the scope of an outbreak in the United States. Now, that's a lot of data to put together and analyze and try to figure out if you can determine some type of action with it. We've actually been able to demonstrate in a proof-of-concept demonstration here in Iowa the ability to share the state premises data, producer movement data, and the diagnostic laboratory testing data to be able to share that all through a tool called AgConnect, which actually looks into the databases where that data is stored, pulls that information, and allows you to visualize it on a map. This type of tool will be essential for the state veterinarians and the federal folks when we have a disease outbreak to actually be able to understand the true scope of an outbreak if we have one here. But the key is that you have to have everybody sharing that type of information in a secure manner, and you have to connect all of that information to that common denominator, which is the Prem ID number.